Dalagyam Basque. Karibu Basque Country. Ongi etorriak Euskal Herrira. Bihotz-bihotzez, itxel posten nau, hemen goian egotie, eta ikustie herri ezberdinetako jendie bateratzen dugula, eta geure aniztasunetik gauza berriak ateratzen direzela. Is with incredible joy, in fact, my voice even cracks, as I stand here, once again, in front of people who believed that people from different parts of the world, unique people, coming together, could come with different ideas and co-create to solve global problems. And since we are disruptive, como somos disruptores, como a través de nuestra diversidad estamos co-creando cosas nuevas, no vamos a abrir este evento de una forma tradicional. Vamos a abrirlo de una forma diferente. La clave hasta ahora ha sido que nosotras en equipos hemos hecho cosas diferentes para dar soluciones nuevas a problemas recurrentes. Entonces, si lo hemos hecho en equipo, ¿por qué no abrir este evento en equipo? En un equipo intercultural. Let's open this event in an intercultural team. And I'm going to do it using this chance to say thank you to, first of all the participants, because you are the true protagonists of today. And all of this happens because of you, because of the community that you are creating. Todo esto ocurre por vosotras, las participantes que estáis haciendo que esto ocurra. Por lo tanto, para empezar a trabajar de manera intercultural, voy a pedir a 3 personas que suban a este escenario, porque entre los 4 vamos a dar con las 4 claves del Africa Basque Challenge. Y va a ser un juego. Y el juego tiene un título. Y a esto nosotros le llamamos Team Talk. O conversaciones de equipo edo talde elkarrizketak. So may I please ask Ambassador of Kenya to come up and join us. Please give a big warm welcome. Karibu, Ambassador. Just choose whichever place you like. I'd also like to ask somebody that has believed in this since the very beginning of times. Somebody that comes representing an organization that believed in this from the very first edition in 2018. So, Alasne, please, will you come up? Alasne from the Agency of Development, la Agencia Vasca de Cooperación al Desarrollo. Choose. And I will also ask somebody who has grown in the cooperative movement. And thanks to the cooperative movement and the belief that through cooperation we can break barriers, we were able to do this. So please, Lander Beloki from Mondragon University. And so I said before, we're going to do a team talk, and we're going to start giving some movement to this, okay? So we're going to be playing with different languages, Basque, English, Spanish. Vamos a estar jugando con diferentes idiomas, francés si queréis, Wolof, Swahili, Luya, lo que queráis, ¿vale? Now, remember, the game is whether after the end of our conversation we are able to hit the keys of the Africa Basque Challenge, okay? So, let me join you. Vamos a ignorar que hay un montón de gente mirándonos aquí o incluso desde Internet. We're going to ignore absolutely everybody and let's have fun together, okay? When we came together, we came as individuals in the Africa Basque Challenge. The key of coming together was that we learn and that we came with so many learnings. We came and together we learned even more. Y quizás ahí está la primera pregunta, leleoko galdera, botako txut, euskeraz esangot, eta gero gaztelerara pasatuko berriro, eta agian hasiko naz, landerrekaz, pentsatuz, geu individualak bezala gatozela. Eta batera, areago ailegaten garela. Afrikar esaera batek, dino, bakarrik harin jungo gara, batera, areago jungo garela. Desde el concepto de espirales de aprendizaje y lo que se está rompiendo de los conceptos en educación del aprendizaje, romper el concepto de enseñar frente a aprender y todo lo que se está haciendo desde el movimiento cooperativo para que el aprendizaje sea en colaboración, ¿qué consideras tú que es clave para que personas como individuos incrementen y lleguen más lejos en su aprendizaje?
Sakoneko galdera. Nik hiru laburtuta, baina hiru elementu identifikatuko nituzke, nik uste dut sustraian kooperatibismo mugimendutik, edo arrasateko kooperatiba mugimendutik ikasten eta joan garenak eta praktikatzen goazenak. Habla de tres elementos que entiendo que son fundamentales, claves, que sintetizan lo que el movimiento cooperativismo en Dragón está impulsando y está activando. Uno de ellos es la conciencia de trabajar en equipo y, por tanto, con el lema que comentabas, de solo voy rápido, en equipo voy más lejos, pues la práctica de todo ello es la realidad cooperativa que vamos construyendo y generando. Luego, esas dinámicas de trabajo entiendo que son fundamentales y explican mucho de lo que hoy veremos aquí, ¿no? Esa es una. La segunda, diría, la conciencia de que en ese equipo la suma de diversidades enriquece el propio proceso de la dinámica y obviamente el resultado, y por tanto eso nos lleva a una conciencia de ser seres en un entorno global, y ese entorno global tratar de concebirlo sin barreras que nos limitan en nuestros espacios potenciales de colaboración y, por tanto, aumentando las sinergias y el potencial tremendo que tenemos de poder trabajar conjuntamente, ¿no? Por tanto, hablaría de trabajar en equipo, hablaría de una conciencia de lo global, y un tercer elemento, y es aprender haciendo. Es decir, vamos transitando de una formación que es dar forma desde fuera a alguien que puede tener sus aspiraciones de tener su propia forma, a generar contextos de aprender, que es un enfoque radicalmente distinto, ¿no? Y por tanto, desde ese aprender haciendo, generar nuevas realidades y transformarse, ¿no? Hiru horiek.
Excellent, brilliant. Thank you for that. I think we can pick from there quite a few things, and in fact that brings us beautifully to the next question, which is for Kenyan ambassador. One of the things throughout these days and throughout the bootcamp, we have had some beautiful conversations. One of them was looking at the IBM example. An IBM example talked about how diverse teams, intercultural teams, can outperform monocultural teams, but they can underperform them as well. And one of the key elements is empathy. It was beautiful when we talked with Mamadou about the difference in the words we use for dialogue, on whether there is empathy on dialogue or not. In Spanish, en castellano, utilizamos la palabra debate. Debate es batirse en la arena. Solo puede haber un ganador o ganadora. La clave quizás de debate there can only be one winner, okay? Because the Greek word is from the Roman times when they fought in the arena. We have badly translated the word we use in Basque for debate, and we call it eztabaida. Now, eztabaida in Basque means it is yes and it is no. Ez eta bai da. So there is a great deal of empathy in that. It's not whether we come out with A or B, or that is in fact that we can come out with A and B, and from that we can construct. And that is what IBM example talked about. And in Wolof, Mamadou explained also the two words. Debate has a part of humiliating your opponent, while dialogue has a part of constructing with the opponent. From your own experience here in Madrid as an ambassador to in such a culturally different place, how will you say that deep empathy has helped in creating bridges between different cultures?
Thank you very much. One, the question you've asked has many layers, and those layers will have many different answers. And those answers will have many different interpretations. And those interpretations will bring us to our own internal conclusion as to exactly what it is, empathy, or what empathizes, or what makes us culturally diverse. Biblically, the Lord in the Old Testament said, "Let me cast you all out so that you may speak in different tongues." And it is from that time that people spoke different languages, people related differently, ate different foods, and came up with diverse cultures. And those cultures have been extended to each one of us as our identity. And our identity is what makes us African, Asian, European. And in doing so, we have lost what is known as the common empathetic connect amongst ourselves as human beings. Because in the colonial days, there was what you call the colonization period, where the Spanish Armada will enter areas in South America. And because of the cultural diversity and differences, those who were already there were more organized by this Spanish ship that comes in to their country. And they are more interested in finding out what it is that has brought this other human being to our shores. You'll remember the story of Christopher Columbus. When he went to India, the first thing he was told is, whichever wind that brought you here, let it be the same wind that will take you back. Because they had already a very strong culture, and they were not empathetic towards any other engagement of another cultural system. Theirs is a culture that has been defined, is strong, and is still prevalent today. In Africa, the Maasai are still the way they were 1,000 years ago, because they refused to become empathetic to a different culture. There are those who are in South America also, tribes which have retained their culture, who have basically not been able to remove themselves from what it is that identifies them as specific human beings from a specific place, and therefore they expect to be appreciated and respected as they are. You have the Aborigines. You have also other cultures in Africa, in Namibia, and also in North Africa, the Mali. But what is it that has been my experience? I have found that the world is becoming closer. More and more people are beginning to learn diverse languages. Spanish happens to be the fourth most spoken language in the world today. That is a cultural dynamic. Why then, as I came to Spain, would I find that Spanish is not spoken in Kenya? Yet, it is spoken in Equatorial Guinea, yet it is spoken by 450 million people. Then it hit me. We fear certain aspects of our cultural dynamics. The Spanish mission was opened in Kenya in 1965. That is over 50 years ago. Yet till today, we do not have that connect. And that connect is a fear brought on by virtue of the fact that an interest has not been served, an interest that is human-faced, an interest that is economic-based, and an interest that is socially based. All these end up creating the empathy. How then do we communicate with respect, protecting our rights, and ensuring that our freedoms are justified? Those are the cultural dynamics, because when you don't understand the language, when you don't appreciate the culture, when you don't respect the individual, and when you don't protect their property and rights, then that empathy may be suffering. And that would be my view of the whole issue. Thank you.
Thank you for that. I connect very much with, especially with what you're saying about fear, as so many writers, and especially in the IBM example that I was telling before, talk like Milton Bennett, who was brought to the Basque Country by Africa Forum and some organizations, and they mention how the scale between cultural diversity and ethnocentrism is a scale of fear. The more fear, the more ethnocentric, the more intercultural, the less fear. That does not mean that to be intercultural we should lose the identity we come from, but rather understand the identity we come from so we can build bridges to others. Which brings me to the bridge to Alasne. And I think es súper interesante que estamos aquí sentados, universidad, instituciones, pero aquí estamos creando empresas. Y resulta que Alasne, que viene de la Agencia de Cooperación al Desarrollo, who comes from the Agency of Cooperation, está aquí sentada con nosotros porque la agencia está apostando por hacer desarrollo a través de la creación de empresas. Y quizás la pregunta para la agencia es desde ahí. Hemos hablado del desarrollo individual, hemos hablado del desarrollo en equipo desde la empatía, y lo que nos queda es la empresa, y es precioso que te podamos hacer la pregunta a ti, que vienes desde la Agencia de Desarrollo, cómo es que la Agencia de Desarrollo apuesta por la co-creación entre distintas kulturas, eta nola izan leike, zeuek hemen zauziela, eta segatik eman dozue apostu hau.
Eskerrik asko, Lander. Zakit da bien? Entzuten da, bai. Orain bai. Gracias por la pregunta, Lander. Yo vendría haciendo un poquito recordatorio de lo que desde Cooperación para el Desarrollo se pretende, que es poder acompañar procesos de desarrollo endógenos en los países en los que se interviene a través de una financiación, puesto que al ser una agencia vasca pues manejamos fondos del gobierno vasco, pero la idea siempre ha sido acompañar procesos de desarrollo sin definición, desarrollo entendido como desarrollo social, económico, territorial, etcétera, etcétera. Entonces, esto quizás como marco para recordar que desde Cooperación para el Desarrollo siempre ha habido una apuesta por acompañar emprendizaje, emprendimiento, autoemprendimiento, desde el País Vasco en concreto, con una apuesta muy potente por todo lo que es el enfoque de género, ¿no? Género en desarrollo, y de ahí pues esa conexión en los procesos que se vienen acompañando de financiar también pues trayectorias de emprendizaje y autoemprendizaje de mujeres. Un poco como marco para recordar que la empresa y la cooperación para el desarrollo no son una dicotomía o no están desconectadas. Ahora, me parecía interesante esta noción un poco más de startup, más de agilidad, de interdisciplinaridad, de interculturalidad en muchas ocasiones, de juventud. Las startups tienen caducidad, o sea, son startups durante unos años, luego ya dejan de serlo, ¿no? Estas connotaciones más de startup me parecían interesantes porque conectan con una visión de la agencia de apostar por la innovación y por una cierta agilidad a través de las herramientas de trabajo de la propia agencia y a través de los procesos que se acompañan. Entonces, el por qué está la Agencia Vasca de Cooperación apostando y acompañando este tipo de procesos puede ser también pues, porque queremos aprender más de procesos de agilidad. Ojalá pudiéramos ser la agencia ágil del Gobierno vasco en términos de poder responder a las necesidades de las ONGs, a las necesidades de los diferentes actores que intervienen en cooperación. Y sí que quería, un poco por compartir, poner encima de la mesa algunos procesos internos de agilidad o de innovación y en concreto uno que es el programa de financiación de programas de cooperación para el desarrollo, que tiene un enfoque bastante innovador, consideramos que es un enfoque global-local y que creo que corresponde y que va en la línea de lo que estábamos comentando ahora, ¿no? Entendiendo que la cooperación, que esto es muy antiguo, pero que ahora con más fuerza, para ser una cooperación que cambie los modelos existentes, pues necesita desde el inicio poder contar con la visión de lo que tradicionalmente se ha oído como países del sur, países del norte, pero que solemos decir un sur global, un norte global, y de ahí un poco esta historia de lo local y lo global, ¿no? Y me parece que estamos en ese momento ahora mismo en la agencia, que es una agencia que quiere trabajar cada vez con más agentes de cooperación, no solo los agentes tradicionales, sino también otros agentes más diversos. Entre ellos, en un lugar bastante preponderante, la universidad y las instituciones, vamos a decir, de formación universitaria, y también las empresas o pues todo lo que pueda tener que ver con el entorno empresarial. Entonces, yo creo que por ahí va esta explicación de por qué estamos aquí, sin olvidar también un compromiso político que es la apuesta por África, por el continente africano, y esto está marcado en nuestro plan director y lo vemos aterrizado en las convocatorias de ayudas en las que establecemos un mínimo de proyectos en África que tienen que ser subvencionados. Entonces, los puentes creo que son varios y desde ahí ese encaje de estar acompañando ya por tercer año, creo, este Africa Basque Challenge.
Bueno, con esto, with this, I shall say that the game has gone okay because you have managed to hit many of the key elements. And I think this manifesto says clearly what Africa Basque Challenge is about. We are a mixture of young entrepreneurs with different paths and with the motivation and willingness to change people's future. We are committed to build socially effective, sustainable, healthier world and transmit the desire to creating social impact in society. Our shared purpose is to improve and co-create solutions to reduce social challenges in our communities. Together we will impact Kenya, Senegal, the Basque Country, and through a shared vision in multicultural companies. Con esto lo que decimos es que en esta pequeña conversación hemos tenido desde el individuo, la persona viene y aprende. Nosotras, desde lo únicas que somos cada una de nosotras y cada una de las participantes que ha hecho este manifiesto, en conjunto se ha aprendido y se ha compartido un propósito común. In common, without fear, we managed to come up with a common purpose. Furthermore, it's not just the purpose. Like Arizmendiarrieta, the father of the cooperative movement here, used to say, del verbo y de la palabra buena es la que se convierte en acción, y el mundo no se nos ha dado solo para observarlo, sino para transformarlo. Entonces, con lo que no estamos de acuerdo, debemos de hacer algo. And we're going to do it through companies. And that's why it's great to see Alasne here talking about companies. But furthermore, the one seat, the one chair that is missing here is the community. Today, we have prizes thanks to the community that was created already in 2018. And the relationships that we are creating endure and go further. And many more businesses are being built out of the challenge than within the challenge. So I challenge you to continue fighting for this purpose together with us, and I'd like you to join me in a big clap to the participants who are creating this challenge. And now, we're going to pick some intensity and we're going to start moving forward a bit faster. So I'd like you to feel it. So I'd like you to feel what we're going to be moving forward now. Quiero que sintáis, porque el siguiente equipo que va a presentar, el primero que va a abrir el Africa Basque Challenge, es un equipo que os va a hacer sentir. Y siente algo diferente. Siente que en las empresas hoy hay unos problemas y quiere hacer algo sobre ello. Unos problemas que afectan a la mentalidad de las personas. We have a team that wants to talk about this. So, please give a big, big warm welcome to the team that is starting today. They will have 5 minutes. Tendrán 5 minutos para explicar en el idioma que quieran su propuesta. Tenemos aquí a un panel que va a estar evaluando esa propuesta. Entre proyecto y proyecto vamos a presentar a una de las personas que están en el jurado. Between team and team, we will present each of the people that are in the jury. So, while Philip comes up, I'd like to first introduce Ollane. Please stand up. Please give a warm welcome to Ollane, who's giving us our time. I said before, the community is the chair that was missing, and Ollane is today our community. She was a member of the first ABC edition. She's now team coach in Lane Arts and has been working in following teams that are creating companies in the creative industries. So thank you, Ollane, for being here today with us. Philip! And please, Philip, come up, 5 minutes. I thought we'll call after 4 minutes and we'll give you, we'll let you know that you're on 4 minutes already. Okay? Thank you very much, Philip.
Okay, so hello everyone. We are David, Mirari, and Alain, and Ekinye, but it's not here today. So first of all, to start, I would like to ask a question to all of you. So if the answer is yes, please raise your hand. So have you ever felt stress at work? Okay, so and have you ever done something to solve that problem? If you have, please raise your hand. Okay, so just in a few seconds, we have seen that this is a real problem, that the well-being is not treated at work, and that we should. So this is not just something that happens here, it's something that happens all around the world. So in a study made in more than 100 countries showed that more than 43% of people is stressed at work. So it's a problem, right? So, and also 1 of 4 people at work will feel a mental breakdown in their lifetime. So this is why we created Feel It. Feel It is a project. Yep, sorry. So Feel It is a project where we work on the mental health and the emotional intelligence of the workers, of the employees of the work, so they can also feel that commitment from the company and also feel all the benefits that has working the mental health at work. As a study showed by Harvard, so you can see here, like the commitment, creativity, energy, and productivity goes up. So we believe that mental health is also a right.
Okay, to have these benefits in our companies, we have Feel It, that we have created a new methodology, an innovative methodology, based on 4 phases. The first one is the analyze. that we have to see the situation of the company. And there we have like some questions for the employees. Then the second one is the co-creative strategy that we make it with the business. The third one is the implementation. And the last one, it will be the follow-up to see the process that they have made. So we have a solutions, but how is going to be the impact? So here we have like 2 of the CDGs that we are like matched with. The first one will be the good health and the well-being that we are treating in the businesses. And the second one will be the 8th one, that is the decent work. So they're working the well-being and also the emotional intelligence of the employees, we can create a most productive people. So that is one of the benefits. And how we are going to measure this? We have like 4 indicators. That will be, the first one is with how many businesses we are working in. Also, how many employees trust our methodology. Also, the rate of demission, because if we work because if we work on the emotional intelligence, we can see that our employees are going to be more loyalty. And the last one, it will be the amount of carbon compared to, because as we see, we are a multicultural. We have to work in the same place, so we have to carry out the traveling cost. So we have to carry out the traveling cost. So our next step to carry out this project, it will be the first one, that is deal with the psychologists to have the methodology. Then we are going to make an MVP in 2 companies of here in Basque Country that are called Alaz and Beno. And then we are going to like analyze the impact, and after all that, we are going to make a landing page, and in a long term, we are going to make a platform. So for that, we will need like a capital that will be like 20,000 euros, but also with this service, we are going to income 15,000 euros for all the process of the service. So that's it. We want to have a solution for this and carry out with it. Thank you.
Excellent. So now we have 3 minutes for questions. So thank you, Philip, for opening up today the Africa Basque Challenge. Now we are opening up the floor. We're going to give the jury a chance to ask any questions and to say what they felt. So we only have 3 minutes. So if any of you have any questions, quickly. Have we got a microphone? Any questions to open up with? Okay, so before we go on, regarding what you explained, my question to you will be, how will you make this work interculturally, and considering that you guys are based here, and you're based in Kenya or in Senegal? Kenya. Okay. So how will you carry on working?
Okay, so first of all, we know that this problem is not something that just happens here. That's why we want to do it all around the world. It would be great, right? But we think that the first step would be starting here. Maybe it's because it's the easiest part of it. But we want to work on the well-being of the employees right in Kenya and right in Korea for the following years.
Excellent. Are you feeling it? Mm-hmm. Yeah? Okay, let's give it a one. Oh, sorry, one more question, quick.
Hello, just a quick question. Can you give us any key of the solution you're thinking about to fight this stress? Because you said that you have a very good four steps program, and you are going to talk with some psychologists to improve this area. But I don't know, maybe you have a couple of keys of the solutions you're thinking about.
So for that, we have been talking with psychologists, and we have carried out that to feel that solution, we have to make questions. That's important to know how we are emotionally, and also in the laboral thing, but to know how we are dealing our emotions, because I think that it's easy to say, yeah, I feel in that, but I don't know how to do the process to don't feel that. So we are thinking on a methodology that we have said, the analyze thing, the how I'm feeling, and then the strategy with the psychologists, but because they know how to solve. So it's that, to have a process.
Thank you.
Excellent. So thank you very much, Philip. And while we prepare for the next contestants, the next team, who I must say, I must stress, before we move on to the next team, I must stress something. We have 4 prizes. Tenemos 4 premios. Eso no quiere decir que esos son los únicos ganadores. Y esto sonaría super hippie flowers, ya digo, todos somos ganadores, ¿no? We're all winners. Es que la clave es que tenemos apoyo para estos 4, pero lo que se ha creado aquí es lo que realmente ha ganado ya todo el planeta. Y eso es lo que es importante, que esto, por mucho que lo estemos lanzando de esta forma, no es una competición para generar ganadores y perdedores. La comunidad es lo que vale, y por eso hemos empezado presentándoos a Ollane de la comunidad que ya hemos creado. The other person that I want to introduce you, who's also part of this community, of this growing community, that wants to change the finance and the companies, is Gorka, who made the question. Please give a warm welcome to Gorka. Gorka comes from an SBAT, but additionally is someone who's behind most of what is happening in impact investment currently in the whole of Spain. Thanks to people like Gorka and like some of the other jury, which I will present you later, investment is no longer being so speculative, and they're opening up investment to be for impact, for positive impact. And that, all of that investment will not work if there weren't people like you creating the companies, ¿ok? Hoy, no sé si alguno de vosotras habéis oído, pero en la radio hablaban de la violencia obstétrica, que seguramente lo he pronunciado mal, pero bueno, no es cosa de broma. Tras el parto y durante el parto, las personas sufren muchísimo, las mujeres y las parejas sufren muchísimo. Many people suffer after birth, and that's why the next team is going to tell us about what they are suggesting, about everything that can be done to try to change the postpartum depressions and everything that happens after birth, which is a global problem and a global issue, not just here, that today is in the process of being turned into a law, a gender violence law, but it is much more than that. So please, give a warm welcome to the next team, Gender Equality.
Hello. We are the Gender Equality team, and first of all, we are going to demonstrate a short theater, and after go straight to the project. Okay. Hello, sir.
Oh, good morning. How are you?
How are you? I'm fine. I'm good. And you?
I'm fine as well. How may I help you?
Seriously, I have a problem. I don't know what's happened with my wife, but 4 months after giving birth, her behavior has changed. I don't know what's happened. He's crying. He shouts on me and sometimes shouts on the baby. When the baby is crying, she's crying too. And we went to the hospital. They told us they do not have a treatment about it. I find a lot of people there, and I have to go to work. That's why I come through to you and find a solution about it.
Thank you very much for coming to us. I think you have come to the right place. And hearing from you, it sounds to me like it is a kind of depression that you're having with your wife. Madam, excuse you as a mother of the baby, can you please explain to me what's going on in your family?
How do I explain how I feel? I feel sad. I feel like no one cares for me. The baby, I'm all alone with the baby. The baby is constantly crying. I have to stay awake at night. And I'm afraid to tell anyone because the society at the end of the day is going to judge me. And they'll be like, I'm a mom. And I'm supposed to take care of the baby and I'm not supposed to complain. So I hope I'm going to find a solution for this before it becomes worse.
Exactly. As I told you earlier, you guys have come to the right place. And we are one of the teams from ABC. We are working on medical, mental, and we have all the solution about healthcare. So I will kindly introduce you to one of the person who can take care of your situation.
This is what we call the 2A PPD, like awareness, assistance to postpartum depression. In Africa, especially in Kenya, in Senegal, we did some research. And we almost know that most of the time, women are affected by PPD. Even in Senegal, I've been the eyewitness in my country where I live. People, they do not know exactly what's called PPD, postpartum depression. Most of the time when they're affected, they are led to the traditional treatments. They do not inform much about what we call really PPD. In Kenya also, we did some interviews. We had some feedbacks from doctors, nurses, and people living the street. And they give the same, and they said the same things, like, we don't know, we are not aware about PPD. So, this is a problem. This is a big problem, because in the world, they say there are thousands, millions of women are affected by this postpartum depression, but as we're concerned, we are working on Kenya and Senegal, because it's something that should be settled as possible as it's come. So this is the theme, aim, and purpose. Use of technology has the fastest method to create awareness and assistance about PPD. Why? Because we know there are so many platforms that do exist in Senegal and in Kenya, but we do like to do a challenge. So only the 32% of the mothers were aware about PPD, whereas 68%, they are not aware about the postpartum depression. So we create a prototype, what we call a prototype of the digital platform. We have the step 1, 2, 3, 4, and 5. So this is kind of like a prototype we have created. So it will be access to the women that are affected or people that are affected by PPD. Our services, have you seen? Menu, the treatment overview, teletherapy, mother and baby program, training session, join a doctor, group support program in urgency. So, and we have our pricing. The subscription, we charge you $60, and consultation, $100, 3 sections per week. And you have just like $60.6 for 45 minutes, and you were faced like with doctoral level, and session usually lasts 45 minutes, while in 15 minutes, you just pay $15. And so these are the team members from Kenya, Fabrice Lokenga, and Shamser. I'm from Senegal, Abdul Hadisek, and this is Papa Djibril Saho. So this is what we do. Thank you so much.
Excellent. Thank you for bringing such an important thing to us. And I'm going to also give you a warm thank you, because you are the only team that is Senegalese and Kenyan. Is that right? Exactly. Yeah. And this is the beauty of how we started. First, we started by joining the Basque country and Kenya. And thanks to these interconnections, we're now making a triangle between Senegal, Kenya, and the Basque Country, and it's this interculturality that is so enriching. Joanna, who's a mother, might have a question herself for you.
So, thank you. Yeah, indeed. I know about PPD, but I knew it after I got it. So my main question is related to it is, if 68% of the people don't know about PPD, how are you going to get the product to the people who don't know that they suffer PPD, like your acquisition channel? And by the way, thanks for the presentation. It was really good.
Thank you.
We are going to introduce a program which is going to create awareness, and then we are going to approach like public sectors, like they connect us to moms directly who have given birth, so as to monitor their progress and to prevent the PPD, so that when one is treated, it can be easier for the person who has gotten the treatment to tell another person who is suffering from the same problem. Yeah, so awareness.
Yes, if I add something. So while we are creating this such platform, because we already know that in Africa, there are so many platforms that exist there. But our challenge is about to be in touch with such women who do not have the availability to go to the hospital because they are afraid, they are fear, or they are afraid to go to the hospital because of the bills they charge them. And sometimes their husband, they are jobless most of the time, and they live in a very hard situation. So where you women are living, in your house, you will just have to be in touch with your computer. You have just to type the 2 APPD. So you will be in touch with our psychologists, with doctors, nurses. So we will know how severe is your depression, and we'll be in touch with some hospital or in your area, and we will treat you by a questionnaire that we will ask you to have after.
And this, I have another question, can I? It's really about your target market because of the pricing and who is your target market, because
yeah, we were thinking about have some collaborators and some partnership. But at this time being, we are thinking to collaborate with some hospitals and some clinics in Kenya and in Senegal, so that it's kind of like 50-50. We are doing like business, and if a customer is in touch with us, so we'll pay. So we just do the subscription, and if you need a consultation, and we charge you. So he will lead you to the hospital or to the clinician, and he will treat you, and then we'll receive the bill at the return, and it will be a business between us, our platform, to the hospital or the clinics in the areas.
Okay, so customers are hospitals, and the people, the customers are, and the beneficiaries are different. Then.
Yeah, they are different.
Okay.
Exactly.
Thank you.
Thank you for that.
You're welcome.
Excellent. Well done, team. Thank you. Now, let's get ready for the next theme. We don't want you to get depressed, but we do need to talk about depression, okay? Now, mental health is a real issue. It's an issue that we face across the globe. And that's why SETU is wanting to do something about it. SETU is wanting to do something about all those people who cannot bring the best version of themselves because of what they are suffering. So before we give a warm welcome to SETU, we had Joanna asking a question, and I'd like to thank Joanna for giving up her time and being here with us. So please, Joanna, let us thank you properly. Joanna is not only a friend and a dear friend to my wife, so let's start with the important things, but is also an activist. Is an activist in many ways. She is spending her time with SFCOP 34, which is a cooperative or a cooperative thinking idea where immigrants can come and be entrepreneurs and actually access the channels of starting their own companies, which they couldn't access through the common or conventional or traditional ways. And thanks to people like Joanna, they are doing that. She's also member of an impact investor team, and it's great to have you here. So thank you so much. So now, please, give a warm welcome to Setu, No Depression.
Hola. I'm just asking a simple question. Do you know that around the world we have 6 million of depressed people? More than 6 million. Did you know it before? I was sure that you didn't. And in Kenya, 1 in 10 person are depressed. This is scary. And sometimes the person can be a relative or someone that you know. Messi, can you explain them your story, please?
About a year and a half ago, I underwent a tragic moment in my life. My life really took a negative turn. I knew I needed help. As a medical student, I knew I needed help. But the help wasn't affordable. I needed therapy 3 days a week for a month. That I couldn't afford as a student. Being in a country that does not, that views depression, or rather mental health, as a taboo, that's not something you just speak about openly. I needed a safe place to talk about my problem without the fear of being judged. And I know most of you think you know what mental health is, or rather what depression is. But when I ask you what depression is, it takes you back and you realize you don't know what depression is. You clearly have no idea, and you want to go back to your books to read further and understand it. Depression really takes a negative turn on your life. As she said, 1 in 10 people in Kenya suffer from depression. And that is why we created a digital platform, a website. The name is Setu. Setu means a mirror, how you view life. You know, a mirror does not take any photographs, has no memory. You step on the mirror, and that is what you see at that precise moment.
So for us, I remember when we present in Nairobi, the judge asked, how can you help depressed people? How? And as she said it, we come up with a website, Setu. Setu. I think there are Senegalese in the room. Setu, you know, Setu is the mirror. And you need to see yourself. Like with the website, you are healing yourself by yourself with help, of course, because when you are depressed, you need help. And in the website, clearly, the first step is to do a test that you're going to do with psychologist or psychiatric, and they will help you, telling you if you are or not depressed, or if yes, in which stage. That's the first step. And then after, you have a choice of management, because people in our countries sometimes don't want to heal their depression because it's a taboo. So you have the choice. Do you want to heal your depression medically or non-medically? So that's the solution we are bringing with the website. And then after, the third thing we constate, is it English? It's that people don't have knowledge about depression. I think Mercy already talked it. So you need to have a platform where you have information, education about depression, and that's what we are giving you with Seto. So the platform will be safe, and people can buy stuffs. And you will ask me maybe which kind of stuff can people buy for healing depression? Yeah, sometimes you can read books. Yes, do you agree? Yeah, give me the feedback so I know that you agree. So you can read books, for example. You can buy other stuffs like accessories that can help you for healing your depression, for managing your depression. So that's the solution. And we have a website. We will show you the website. It's not done yet, but it's the example. I think, yeah, they will show it us. Oh, it's going to be very complicated. We won't lose time.
Thank you for that. The issues that you're dealing with are very, very important, especially if you join the rate of suicide, not only in Senegal and Kenya, but if we take the United States, for example, the rate of suicide in the United States kills more people than what COVID has killed. If it was declared, it would be a pandemic. So this is a very important global issue, and I don't know if any of the members of the jury have any questions about this. Please.
Thank you for that. I'm a Kenyan. I hope I'm not depressed. But I just wanted to understand your pricing model. Maybe you would have shown us on the website, but just explain to us so that we know how the business model that you are coming up to solve this problem. The problem is very clear to us, but what is the pricing model or the business as model?
We came up with premium packages, and we've got the least package, which goes at $10. So we take $10 times 1,000. We get $10 times 1,000 times 6 months. So we get $100. No, $100,000. So that money is going to help us sustain our project.
Any more questions? Okay, well, thank you very much. Now, let me take this opportunity to present from the Embassy of Kenya. Not only the Kenyan Embassy believed in the first ABC, and their cooperative university had dealings with our cooperative university many moons back, but today both ambassador and officers have come across and they are here in the jury. So I'd like you all to give a warm welcome for being here. Thank you very much. Now, it's time for all of us to do something different. Danok zeozer ezberdin egingo dugu. Beraz, Danok, mesedez etorri hona eta adierazi zenolako erantzun berezia emoten ari zarien mundu osoan gertatzen ari dan arazo handi batetara. Please give a warm welcome, all of us, Danok batera, to Danok.
Hello, everyone. Just for a minute, I need you to be Marcy. Marcy is a 16-year-old girl living in Nairobi, Kenya. She has intellectual disability. she has been stuck in primary school for 4 years. And the reason she has been stuck in primary school for 4 years is that she is in a class with a lot of students. And the current education is not suited for her advancement to other classes. Marcy is 16 years old, and 16 years old in Kenya is the age of a child going to high school. So what happens? You are stuck in primary school, you do not get education, you do not get skills, you cannot get a job. Therefore, you cannot get employment, and therefore you cannot get money to access basic needs such as water, such as food, such as shelter, such as healthcare services. This is a true story of Marcy, a girl in Nairobi, Kenya. I met Marcy when I was volunteering at a school in Kawangware. When I got a chance to come to the Africa Basque Challenge, I got excited because I knew I could get an opportunity to help people such as Marcy. And I met my team who are very motivated to have inclusion in the society. So let me give you a figure, an example of the data currently in Kenya. There are 750,000 people, children in Kenya who have disabilities, general disabilities. And only 6% of this population is going to school. And only 2% of this population have an education system that is adapted to their disability. So what happens? These people don't get skills, they don't get jobs, and they don't have money. So we formed DANOC, which means everyone in Basque. We want to have an inclusive society where people have access to education and therefore have access to money and can access basic things. So we developed a methodology to teach young children with intellectual disabilities for their own advancement. This methodology has 5 pillars. 1, maths. 2, language. 3, practical life, multisensory learning, and cultural topics. So this is the school we went to, the Humanitarian Educational Center. It has 70 students. And as you can see in the figures, we have different students with different disabilities. But what we want to do is to focus on children with intellectual disabilities, which are 30 learners. Our plan is to prototype on our methodology in this school with this set of students. After we have done our prototype, we want to scale up to other schools. We also want to create a facility where we have more students with intellectual disabilities coming to the school for their own advancement. Later on, we want to scale up to different parts of Kenya and then include children with all ages so that we can also be able to train them on employability skills, get internship opportunities for them so that they can get jobs. What is our business model? So in the business model, I'm going to talk about 2 things: our cost structure and our sources of revenue, what we think our source of revenue is. So we need money for materials for education, we need money for infrastructure, and we need money to pay the facilitators. What we think our source of revenue as per now will be through collaborations with the ministries of education, both in Kenya and in the Basque, collaboration with corporates, and crowdfunding. Thank you. And this is our contact, DANOC community.
Excellent. Thank you very much. It's great to see that we are being inclusive, and in fact, our diversity is not intercultural only. The diversity is multifunctional as well. On the first edition, we were lucky to count with a Somali who could not see and who still today is continuously gifting the whole community with great things that the Somali community is doing thanks to his incredible power to have a vision to create inclusivity. So thank you for such a such a interesting and such a needed proposal. I don't know if the jury has any questions for this. I'll throw you a question then. Regarding your cost structure, and I didn't see any charge to the actual family or the individual that is going to be formed. Is that for a reason, or are you thinking of actually creating some sort of relationship, economic relationship with the potential students that are going to be studying in your methodology?
Paula is a financial, let me, she's in charge of finances.
I didn't understand very well the question.
So on your income structure, I saw that you were wanting to have money from NGOs, from companies.
Yes.
Yeah. What about the students and their families themselves? Will they not pay?
No, eventually they aren't paying, and our plan is to get money outside the parents because they now can't pay and they can't afford going to school. And Mrs. Rose, which is the director of the school, is doing it by her own and as she can. So we are expecting to get money outside from the parents.
On top of that, the whole setting is done in Kawangware. We didn't have time, but we have explained in our document. Kawangware is one of the largest slums in Africa. In Africa, young people, more so the children, have been excluded because these are families who live below $1. Can we remain silent and keep dumb about it? No. That's why Dano comes in. There are many NGOs trying to reach them, but they don't have a methodology to reach an individualized context. That's why the DANOC is creating a community to involve parents, to involve children, and in a long term, the methodology is going to address the exclusion part because it is a part that has been economically disadvantaged. Thank you.
Well, thank you very much. Excellent. It's great to see inclusion, especially as we know today that diverse abilities give many people different capacities. One of the lessons that some of the companies that work here with people with diverse ability is shown that, for example, autistic people can produce much more than the people that are actually don't have the disability. And because they can center themselves much more. Y hay modelos de negocio hoy en Euskadi que funcionan de esta forma. Aprovecho para presentar entonces a la siguiente persona que todavía no conocéis, que está aquí con nosotros dedicando su tiempo. Ya os hemos presentado a dos personas que están transformando el sector de inversión. Quizás ahora es el momento a presentaros a la tercera persona, John Miquel. John Miquel is transforming the investment sector with SIP2B as an impact investor, and not only is he giving he's giving his time today, but he also gave his time to all the teams and to the key protagonists of today to show them on how they could actually measure their impact. To know that impact can be one of the key elements to be a key for your investment proposal, okay? So thank you very much, John Miquel. And thank you, SIP2B. And it's time to give the future, to put the future first. So let's give a warm welcome to Children First.
Hello, everyone. Today, we are going to present you the story of a child called Lamin. Lamin is a young boy of 10 years old. He lives in Ganjol, a real area from Senegal. He suffers from gastric problem. The problem is that he drinks poor water quality, and then he's not the only one. Most of people there are facing of this problem due to poor water quality. Lamin cannot go to school because he has to support his parents to do the field work. And also, his parents cannot afford to pay him for these school supplies because their only income depends on agriculture.
As Osman have told you, Lamin is not the only one, and the whole community is being affected by the lack of education in Gandiol, the rural area of Senegal. So our proposal for today is a proposal made to give the right access to the education about healthcare to the children from the rural areas. How are we going to do it? We are going to create books, but these books are not going to be usual books. These books are going to be plain of knowledge about healthcare, and there we can find knowledge about how to treat, how to avoid, and how to see the symptoms of a disease that they could suffer in the country. So for that we are going to create two different books, because now we are talking about Senegal, but the lack of education about healthcare is also a problem that we usually suffer here in the Basque Country. So the first book that we are going to create is the paper healthcare book, that is going to be focused in the children that already lived in the Basque Country. And it is going to be a book that is almost made by paper, and there we are going to find information about how to avoid diseases that we usually could get here in the Basque Country. Okay, so the second book that we are going to say is the filter paper health care book. This book, the difference between this book and the other one is that this book is going to have 24 pages more than the other one. Those 24 pages are going to be made of filters. Those filters, those are pages that are made of silver particles that will allow us to clean the water. So when you take off a page of those books, you are going to have the ability to clean the water. Each paper gives us the opportunity to clean 100 liters of water in 13 days. So the book has, as it has 24 pages, the book it will give like a whole family for 2 years clean water. The financiation for this project is going to be based on the next business model. Per book sell in the Basque Country, we are going to send another one to Gandiol, the rural area in Senegal. So to financiate this, our potential customers are going to be companies, individuals, schools, and so from the Basque Country, so that one book is sold there, we are going to sell another one with this extra of the cleaning pages, water cleaning pages to Gandiol. Apart from that, at the hour of selling, the clients are going to have the option to pay a donation, so at the students, like medical students that are in Gandiol, will have the opportunity with this money to give training sessions to children and young people on Gandiol to learn about how to use this book. And here you can see our roadmap. As you could see, we are located in February 2022. That is where the idea have been created. And our objective is to September 2022 to create the first MVP. So during this process, we are going to design the content of the books. We are going to prototype the first book with a company that has already made the filters of the book that we want to use. And we are going to do the first sales here in the Basque Country. So our objective, if we made our objective in September 2022, we're going to create impact in 200 children. If we sell the first 100 book, we are going to create impact in 200 children, in 200 families. That means that we are going to create impact in 800 people. And we are going to give also the opportunity to those families to create, to have clean water for 2 years. So with this presentation, for finish, I want to present you the team. We are Laura, Irene, Osman, Baba, and Anne. And we have united our efforts and our motivations to create this project. So we invite you all to be part of this project. So thank you so much for listening.
Excellent that you are bringing books into this, because we can connect to that, especially since Ivy, one of the Kenyan participants of the first ABC edition, who was part of Oyane's team, ended up coming here with a grant. She is finishing Lane, Leadership in Innovation and Entrepreneurship, and before finishing, she's already published 2 books. One of them is on sex education, especially for young girls, and the other one as a young influencer of what it can be done without us becoming the shadow and basically lighting a light on the way. So before I let myself carry on, which I would like to much more, let me give a chance to the jury for any further questions. John Mikel, please.
I have a question. You didn't say where would the books would be produced. If they are produced in Africa, perhaps they could generate more jobs. And another side of the production is if you produce them in Europe, if you have a shortage like we have had in the pandemic, no books will get there, so no filtered water. Have you thought about these issues on your operations?
Okay, as we said, we are going to collaborate with Water is Life company. This company is situated in the United States because at the beginning, like the production is going to be $2, which is much more like affordable for us and for the families, like to clean the water and so. So at the beginning, they are going to be produced in the United States, but as the company goes on and we get like more benefits, we would like to do to manufacture them in Senegal, sorry, to give like more job employees to the people from there, and thank you.
Excellent. Well, thank you very much. Children first. It's excellent that you have connected us to Gandiol, because from Gandiol today, we have a person that has managed to create a real change. He's an inspiration to many of us, because from his work and from the collaboration with other people from here, and especially I see Ainhoa back there, and Carlos, who's somewhere around here, through that, Mamadou is creating real change in Gandiol, in a rural community. And today he's here because thanks to him and the team, they have brought 6 participants from Senegal, all the way to the bootcamp in Kenya, and all the way to the bootcamp here. Their work is proof that through culture and in diverse teams, you can create things that are different. Today, there are 85 people working in 7 different companies, and all started from the vision that he wanted the youth of Gandiol to have opportunities in Gandiol and to change the narrative of the poor African into an empowered African that can create impact in the world. So thank you, Mamadou, for being here today with us. Now, many families across the world are impacted by diabetes. Diabetes is an issue that is going further and further, even more because of the ways in which we eat artificial food. So please, give a warm welcome to a team that not only is doing something about it, but has suffered the consequences because one of the team members had to actually be in hospital during the boot camp because of her issue with diabetes. Thank you for overcoming the diabetes and for being here with us.
Hola. That's the only thing I remember from the hospital. So I'm Qureisha Noor from Kenya, 22 years old. I'm diabetic for 15 years now. And I just arrived in Bilbao on Sunday, and Monday got admitted to the hospital because of the environmental changes. My sugars were hypo and again hyper, and I'm just from the hospital yesterday. Do you know that diabetes is killing many people more than even COVID? So this is COVID, 5.79 million deaths, and this is diabetes, 6 million deaths, 1 in every 5 seconds. So we have the statistics from World Health Organization and from Johns Hopkins. Over 500 million people live with diabetes globally, and also diabetes is one of the most dangerous non-communicable diseases. Now, the challenges of diabetes. As you know, diabetes, there's something that is called glucometer that we use to measure our blood glucose levels in our bodies. And the main challenge is the current glucometers that we're using is really prone to human errors and is so uncomfortable because removing the blood from the finger and pricking it all the time. So the future of diabetes is where the patient is truly control of their health. So right now, no startup or company in the world has been able to come up with such a device, but we, Technia, did it. So this is our device, and with this device, we are not going to, prick or remove the blood from the finger. We're just going to use a sensor, thumb, and I will be so glad to use this. I will start using it before anyone else, because they have been pricking my fingers, and I'm so tired. And also, we are going to this is our long-term goal, coming up with a bracelet that's going to act also as a sensor, which is painless, of course, and less prone to infections, and it will be connected to an app. Where are we today? We have designed our prototype, tested and validated. We have tested it 3 times in Kajiado Referral Hospital in Kenya, and we demonstrated the device and tested to over 50 diabetic people, and currently we have 100 pre-orders from the patients, and also 3 hospitals are willing to buy the device as per now. So the existing solutions in the market, as I said, it's the glucometer. You have to prick the finger, which is so prone to infections and so uncomfortable. And also we have the CGM, the continuous glucose monitoring. It's a sensor, and it's very, very, very expensive. I've tried to buy it here yesterday, and it's truly expensive. And advantages of our device, portable, of course, and very light, 100 grams, accurate and no pain, very convenient and price friendly. This is the global diabetes market. Currently, it stands at $30 billion, and by 2025, it will be $60 billion. At the same time, the diabetes devices in the market stands at 31 billion, and it will be at 81.7 billion. Our business model, we have the basic package and the pro package. The basic package will go with $150 per device, and then $40 only monthly subscription, and then it will come with all these benefits: in-app consultation, 24-hour patient support, real-time doctor update of your sugars. Then we also have the pro package, $150, and then $80 monthly subscription, sugar prediction algorithm, and 24/7 patient support, real-time doctor update of your sugars. So it will be able to connect you to the doctor and, of course, control your sugars. We have the conclusion, continuous monitoring solution. It has not yet been implemented. We are the first one to implement the device for the last 10 years. And then our focus is currently in Nairobi, Kenya, because we already have the pre-orders from the hospitals and the patients. And then the device, we did it less than a month, using less than $50 and using second-hand materials. And yes, our potential is very big, so fund us, support us, guide us, and mentor us. Our next step, we have the short-term goals and the long-term goals. The short-term goals is, of course, to advance on the app and engage with the GPs and the hospitals. Our 1-year goal is apply for funding and, of course, collaborations, with Mondragon University and Este. Also expand to Europe, and yes, get the FDA approval. Thank you. This is the team. Thank you.
Thanks for that. Brilliant. Any questions from the jury? Joanna?
That's a good question. The good thing with this is that no one has been able to do it up to now, even Apple and Google and Microsoft. So we did it. They've been trying to do it for the last 10 years. Everyone has been speaking about it, but we did it in less than a month using second-hand materials. So do I need to talk about the technology behind it? Yeah. Okay. There is a lot of photonics behind it. We have a PhD in photonics, Dr. Pierre. And the principle behind the working is that the refractive index of blood has a strong correlation to the sugar concentration in blood. So you don't have to remove blood from the tissues.
Maybe Dr. Pierre, who's here, can also show you the. Is it where you wanted to show that? Yeah.
So in fact, you can imagine that you have the bracelet on the wrist, and basically with some LEDs, you'll be able to display if a patient is healthy or is in a middle stage, or even if it is in a bad state. At that moment, what you can do, you can create an alarm, and it can advise the patient and also the general public around the patient that some action need to be done in terms of the emergency. And for the various sensors, in fact, well, since it is kind of touching the skin, there are various other LEDs and ultrasound technologies that can be combined to extract the full biometrics information.
One more question very quickly so we give a chance to the other teams.
Could the device be sold on its own without the app? Have you thought about this and the production? Or
Okay, yeah, you can do the device without the app, but then it will be good for the patient to go with the app because the app is able to analyze the data and predict for him whether the sugar levels will rise or fall from 3 hours from now or so that he doesn't go collapsing or that kind of impromptu sugar spikes.
Thank you very much. Okay, very quickly so that we are fair to the rest of the teams.
Do you have enough materials to produce the device? You have said you're using locally available materials. Do you think you have enough to go commercial and large scale?
Before you answer, I'm going to advise you one thing. To be fair to the other teams, and thank you for the question, it's an excellent question, but to be fair to the other teams, if you want to carry on the conversation after, and I take my hat off to all those pre-orders that you've done in Kenya, so well done to you. Cheers. Okay, now, what can we not live without for more than a couple of days? What is our body made of? Water, indeed. The team that we're going to have now is going to talk us about water. There is a saying, you know, life is like water. You might be going down the river today, but you might be going down the drain tomorrow. So let's not go down the drain, and let's concentrate on where we're going. Before that, I wanted to also introduce you to somebody else who's giving his time to be here and to support this, all of these participants the same way he's been supporting us at the very beginning, talking from the cooperative learning. So please give a warm welcome to Lander Beloki, who's here in the jury supporting the teams. And now, what a team, please, come in.
Okay, good afternoon to everyone. We are Mohamed, Emma, Leon, Oyer, and Cecilia, and together we are URE, a company that is trying to solve water challenges all over the world.
Now, 80% of Kenya is dry. 80% of Kenya is dry. 23 million of Kenyans, which is 43% of households in Kenya, do not have access to water. And of those who have access to water, the water is polluted. And polluted water leads to bacterial diseases, parasitic infections, and all sorts of pathogens. Now, our project is based in Kitengela, and to the extreme right, you can see a man traveling tens and tens of kilometers to fetch water. This water is quite expensive, up to 20 cents, which the locals cannot afford. Now, as we walked into the market in Kitengela, we had to wash our hands. It was the third wave of COVID, and the number of cases were quite high. So as we tried to wash our hands, the station for water was dry. There was no water to wash our hands as we walked into the market. And as we walked into the market, we found a lady who was selling her goods. Now, she could not sell her goods because her child was thirsty. Herself, she was thirsty, but she could not drink this water, all right, because of her child. So what we are proposing is, in Kitengela, where we have 154,000 people in this community, which is a rising population, the water is not sufficient. Now, we are able to provide a third of the population within 24 hours, which is 55,000 people with adequate water. And that way, we will reduce 50% of the illnesses in those hospitals in the area there. Now, in the nanofiltration system, which is the system we're proposing, we'll dig a borehole that is 1,000 feet deep. This borehole will not dry out throughout the year, so it's constant supply of water. It'll filter the sand, the gravel, and all the big rocks. Then the UV radiation will kill the bacteria, so it's free of bacteria. Thereafter, the micro and nano filters will remove the excess levels of fluoride within the water. Thereafter, okay, we'll chlorinate the water, and the chlorine in the water will make the water have a residual effect, and that way it can last longer.
So what you're seeing now is the actual filtration system. It has been tested in an informal settlement in Kibera. So this system is also producing 13,000, it's providing water for 13,000 people daily. This is the engineer in charge of the project, and this is the community center where the project is being run. Next, please. So our business model, our value proposition is that we are providing three things that the community needs. They need clean water, they need consistent water supply, and they need affordable water, which is what we are going to be doing with the community and for the community. We are targeting three demographics. One is households. Two are small businesses, like the lady in the market, that water she needs to run her business, and three essential services in the area. Because one of the things we experienced personally with Cecilia is that there was no water in public toilets, in the hospitals, at the police station, and these are places that are frequently visited. Our key message as we're implementing this solution is to have clean water, to teach you how to save water, and to teach you how to recycle water and anything involved in your usage of water. We are going to partner with key institutions that we've already begun discussions with. One is the county government, of course. Another one is the sub-county hospital to monitor if the infections, if they are reducing because of the water. We are also in talks with a consortium of NGOs that is implementing water solutions in other parts of the country for knowledge and insight. We are also partnering with Este. We have requested them in terms of the technology on our making renewable energy to power our machine and other partners. Sorry. These are the costs. Our project is going to cost about 81,000 euros to begin, and this is how we plan to recover it, through selling the water and building other businesses around our machine to sustain the business. Our impact indicators are: 1, we plan to provide 40,000 liters of water daily. We plan to reduce, to create employment, at least 50 per year around the businesses. We plan to reduce the outpatient visits, and because there will be water supply in the community, we are targeting 100 new businesses every year, which will be possible. These are the timelines. This is where we are now. Our next immediate step is to test the water and begin customizing the design based on our area of implementation. Thank you.
Well done. There is a Taoist saying that says, life is like water, is a stream that throws you in the banks, throws you in waterfalls, it ruffles you in rapids, but you may choose to cling to its banks and stay always safe. But you will never cry with all your tears or laugh with all your laughter. You have chosen to fight on those rapids and to fight it together. So it's great to see you here together. Any questions for this team? Please, Gorka.
Do you have any pricing policy or something like that? Because we saw the cost, and you talk about who are you going to charge with sales of water and laundry. I don't know if you have any plan for pricing.
Yes, we do. Currently, the community buys fresh water at 10 cents, 20 cents. 40 cents, and salt water at 20. So we plan to sell it at half of that, and all of it being fresh. And that in itself, when we're producing 40,000 liters of water a day, is going to be enough to generate enough revenue to reinvest back into the business.
Okay, great. Thank you. Thank you.
One more question.
Thank you for the presentation. I would like to know more about how do you organize between yourselves? Which are the roles that each of you has in the team?
Personally, I'm in the medical field, so matters regarding, the levels of equalize an indicator of how dirty the water is from a medical microbiological point of view. So regarding the purity of water, together with Leon here, who's an industrial chemist, will ensure that the water itself is safe for human consumption.
Personally, I deal with the sustainability of the business because my strength is in building business and entrepreneurship. I don't know if...
Okay, I take care of the presentations, the marketing, like things like Instagram and this kind of stuff. Cecilia?
And I'm in the part of finance and the cost and, yes, the accountability.
Thank you very much. Excellent. Excellent. So today, on the jury, we only have one more person to introduce. And you've already met her before, and it's very interesting because she's got two hats. One is the hat that she works with in development and cooperation, but she's also worked in entrepreneurship and promoting companies. And that's why it was so interesting to have her today sitting down with us. So please give a warm welcome to Alasne, and thank you very much for being here. So let us now give a warm welcome to the next team. The next team, we're going to pick up the pace because in very short time we're going to be evaluating all the teams together. En poco vamos a evaluar a todos los equipos. Durante la evaluación os vamos a dejar un tiempo para que compartáis y hagamos más comunidad ahí atrás. Y luego lanzaremos los 4 equipos para los que tenemos una propuesta de de varios temas. Los 3 equipos, perdón, que tenemos, que son, serán apoyados por Bridge for Billions. Bridge for Billions les dará una mentorización que tiene una red de más de 400 mentores por todo el mundo. Y luego tenemos 3 premios de dinero, y aquí quiero agradecer a Gastón y Aritz, que estáis por ahí, miembros de participantes del primer ABC, y gracias a ellos, dinero que no se usó entonces, lo están compartiendo con los ganadores aquí. O sea que milla esker, y con esto aprovechamos. We give a warm welcome to Pauso.
Hello, my name is Victor Baraza, and I'll be presenting POSO. Since we are young children, we were taught that we are leaders of tomorrow. And through the African Basque Challenge, we were taught various values inculcated in us, such as collaboration, teamwork, innovation, and social entrepreneurship. In this concern, we decided to solve one of the biggest challenges in healthcare. This is for people with functional diversity. We did various customer visits, and I would like to share a story of one of our customers. Her name is Farida. Farida is a 38-year-old lady who lives in Dagoretti, Nairobi. She has 3 children, and of these, one is a 2-year-old boy. While going to her household, we were met by her oldest son, who is 7 years old, who took us up a flight of stairs to meet her. On meeting the lady, we found her on crutches, and significantly, she had challenges moving around the house. She shared that she had lost her leg from a road traffic accident, and this caused her to lose her job, making her to live at home, just staying idle, and being the stock of shame among her neighbors. Various people face these challenges, among others, who lose their limbs as a result of diabetes and road traffic accidents. The numbers include 10% of Kenyans who have this challenge. To solve this, our team came up with an innovative solution, leveraging on 3D technology and recycled plastic waste to create prosthetic limbs. I'll show a demonstration of one of our prototype here that we created in collaboration with Este. As you can see, it's moving. Compared to original solutions, ours is cheaper, efficient as one gets it seamlessly, and we use recycled material, hence it's sustainable, and we co-create the solution together with the user. Here it's in the design process. In our business model, it's B2B2C, which our main customers will be institutions and NGOs. These are customers with a high purchasing power, who will enable us to subsidize the cost for the low-income groups so that they can be able to afford this. In addition to it, we have an innovative business model which involves payments slowly in installments, and also collaborative community. We aim to impact 4 million individuals and build self-confidence and well-being of the users. As you can see, we'll also create jobs and improve the economy as users can be able to continue with their revenue streams. Finally, in sustainability, we will create a community of prosthetic users who will have events and various trainings on how to use the prosthetics. We will also use recycled plastic, hence reducing pollution, and we will plant trees to offset the carbon used in the process of producing the prosthetic using plastic. Finally, our solution involves 3D prosthetics, recycled plastics, and a community of users. On the traction, since the hackathon started, we've partnered with OsteoPhoenix, who have shared their technology and expertise with us, and Este University, who've offered their 3D lab for us to build our prototypes. We're also using technology, open source technology from IUMED and 3D Labs to create and design this solution. Finally, our next steps include incorporating the company, building our pilot phase in collaboration with Association of People with Disability in Kenya so as to test and refine our products. We also plan to market and sell our prosthetic limbs to 500 individuals. Finally, I would like you to trust us, this team, to build this solution and create impact. Thank you.
Excellent. Recycled plastic has been one of the key elements in many of the previous editions. Proof of the collaborations that can happen is the fact that one of the projects that Mamadou has in Gandiol, the machines were open source, the programs were open source, it's called Precious Plastic. The machines were done in one of our vocational training schools, the School of Somorrostro. And it's actually currently being used on a business that currently works, that creates the keels or the fins of the surfboards and is selling in Brazil. They produce them in Gandiol and they sell them in Brazil. So certainly there is a great deal to do with recycled plastic and especially with cleaning the plastic from the sea. Any questions from the jury? No questions? Well, question for you guys then. Where will all of that plastic come from?
We were thinking of China or India because there are a lot of air pollution because of plastic, but instead of traveling that plastic to Basque Country, we will take part with a company from the Basque Country and we'll start producing it here locally and then expanding into the hospitals from here, and the 30% of that sales, we will use them to give the prosthetics to Kenya or Senegal.
In addition, because the project will start from Kenya, we have a company in Kenya that already does the recycling of plastics in a cheaper method. So we will also outsource that company. And then because of scalability, we will start it at Kenya and then upscale it to the Eastern Africa market, and then the African market, and then globally.
Excellent.
Yeah, I just wanted to add that we didn't say that, but our financing method is going to those developed countries, and with that revenues, our aim is to donate some of our parts of the prosthetics to Kenya, and for that we have APDK as an association that also they have all the machineries and the raw materials as plastics, so for us to use them. Yeah.
Excellent, thank you very much. Now, I have a challenge for all of you, and the challenge is the following. This is an initiative for co-creating. We are breaking any sort of white savior concept. We do not believe in that. We believe in co-creating, okay? So up to now, we've been using terms like developing countries, we've been using terms like third world, we've been using terms that in a way put some people at a different position to others. I challenge you to start using a different term, a term that has been developed from the countries that we call them Global South. What they said is, we're not the Global South. We, in terms of population, are the global majority. Because the industrialized countries don't actually add not even to 30% of the population of the world. So I challenge you from now on in the ABC that we talk about the global majority and that we level up, okay? And with that, please, let's level up with the first sector that gives us what we eat. Please give a warm welcome to FarmLink.
Hello, everyone. My name is Fernando Saluda. I'm from Kenya. These are my teammates, Caroline, Michelle, and Edwin. So our project is called FarmLink. To begin with, I'd like to ask you, did everyone here have had a meal today? Can you tell me if you remember what meal you had? Was it balanced diet or is it meeting your nutrition requirements of your body? Probably you don't know. That's the obvious questions. But what influences you to know that you're having a nutrition balanced meal is because of the availability of food. If there's no food, is when you realize you usually eat poor. But when there's food, you won't realize what you're eating, but you'll end up eating, probably, high chances are, you'll eat a big, balanced diet. But now, according to the statistics in Kenya, here it shows that during the month of January, the population of people who are unable to have access to food or consume food drops. And when it reaches March, the number increases. This pattern, after looking at the data and the statistics and after doing some interviews among the locals, we realized that this number is greatly influenced by agriculture, especially since the numbers represent, like in January, is usually when people have just gotten from harvesting. And here the numbers reduce because harvesting is the harvesting period. While these other numbers where the numbers are high, at periods when farmers are now investing in farming or the season of farming has begun, whereby now there's no available food. So on return to that, we realize that farming is greatly influencing the availability of food and hunger in Kenya. Depending on the interviews we did, we realized that we have to improve on farming so that we can be able to compensate the hunger that is there. So whereby we want to encourage farmers, they'll be able to have the requirement resources so that they can be able to produce more food for the community and the world itself. Since everyone depends here, currently depend on farming. So to do that, we remember there's a common saying among business people where they say, teach me how to fish and don't give me fish. But also, if you teach me how to fish and you don't give me the requirements of fishing, I won't be able to fish. And that's where our project comes in.
So, our solution is to provide training about regenerative agriculture and farming inputs, which are like, for example, tools to plant and seeds and eventually, if needed, organic fertilizers. So, what is special about our program? Well, we want to first do a land assessment of each farmer, so to know exactly who has what, and to also know how is the quality of the soil and be able to say what are actually the crops that we can plant. Then the experts that are going to give classes for the farmers, and afterwards the farmers and the experts are going to create a plan of what they're going to plant for the next seasons in order to enhance the food security among the community. So, on the other side, in the farming inputs, well, we want to do it as a credit, but it's going to be a bit special because a group of 4 farmers, imagine, is going to sign a contract, and there will be guarantors between each other. So this means that if one of the farmers fails to pay one of the installments, the other 3 farmers are reliable for each other. So in this sense, we enhance also cooperativity and solidarity among the farmers. But in a concrete plan, how does it look like? Well, we want to have a pilot project in Figa, that is a village close to Nairobi in Kenya. And here we can see that we need to start with an event organization in order to gather the farmers and to see who would be interested in the program. Then we would need to cover the cost of the experts, the transports, and of course the farming inputs. As we can see, we are not going to cover the cost after the first year. So, yeah, this is the amount of money that we would need in order to start, so 2,215 euros. But we calculated that after 3 years, if we have a group of 10 groups of 4 farmers, our expenses are going to be 13,870 euros. But in the 3rd year, our income, only with the farming inputs, is going to overcome our costs. So it is affordable after 3 years.
64 is a number of farmers who will impact after 3 years. For the first year, we are going to impact one group of 4 farmers. For the second year, we are going to impact 20 of them. And for the third year, we are going to impact 40 of them. Then after that, we are going to give jobs because we need people who will be able to give trainings to our farmers. And after that, we will be able to increase the productivity, and then the prices of products will decrease, and more people will be able to get food. And so we are getting food insurance.
And lastly, to invest in technology-wise, we are going to come up with a mobile application that does not need to use internet because it's so much expensive. We tend to use the code that's called USSD. That means an unstructured supplementary service data where a farmer can press either given code *123# and give them the service. This platform comes for free, doesn't need so much money to connect the farmers. Secondly, we're going to come with a network of farmers where we link them together. Each farmer knows each other, they know their products, and that they can connect more farmers to the program. And lastly, we're going to link the farmers to the market so that they can sell their produce on time, to enhance them pay for the installments well on time and actually raise the revenue. Thank you. And the team.
Brilliant, excellent. Now, we needed the connection to the first sector, so we actually did the whole connections with this whole community. I know that Mamadou is currently working with farming as well. I don't know if you guys have any questions for this team.
Thank you, guys. You hear me? Thank you, guys. So I want just to know how will be the first step for your implementation, for the final, for the financial project.
Thank you so much for your question. Well, we took the village that is next to Nairobi, Sofika, and there the first thing to do is that the participants that are based in Nairobi will go to this village and first create an event to promote the idea, and then with an expert to also give credibility and explain the issues. Then it's going to be a sort of challenge where we'll then choose one group of 4 farmers in order to test it, and it's going to be a sort of pilot project. And if it succeeds, then we want to continue and to expand it to other farmers. But if it fails, somehow we want to give this pressure in the community. So if the first pilot project doesn't work, the others won't be able to access it either. So they have the pressure to make it well.
To add, we can say that we plan to see certain NGOs in Kenya and wherever, and Burkina Faso and so, which can be able to help us, and they are so excited to know about our idea. Also, we have decided to put for ourselves 500 euros to begin our project.
Well, thank you very much. Thank you very much, Family Link. Now, it's been intense. The learning is no longer out of just the participants. We now have a collective learning that we are creating, and it's time to see how we can share those 3 prizes that we have. So I will give you now 20 minutes to mingle, to understand more, to have any further questions to any of the teams. And meanwhile, I will ask the jury to come down to the first floor where we are going to be evaluating the panel. Muchísimas gracias. Mila esker a todos por estar aquí. Volvemos a las 8 menos 10. We come back at 10 to 8. Okay? Let's go! Are we ready to start? Okay. I'm going to give you a suggestion so that we can all get ready to, if you're ready to reconnect, raise your hand. Raise your hand. Excellent. Now, so there is many, as we said before, the importance is what you guys have done. And the real clap here is to you, to the community that you are creating, to the community that it has been created from before, and it's great to have Muriel, for example, here, and many other people that took part already on the first ABC, and once again they are back in the Basque country. And once again we've been able to go to Kenya. The real protagonists are yourselves. There is much more than the 3 prizes that we're going to give. Because this community is live and because there is many more things that can be done, we are working to create an interconnecting program so we can send people across for 3 months to Kenya or Senegal, and people from Kenya or Senegal can come across to here. So in 8 months, we are hoping to have that running. We also have a suggestion to have 2 teams to go through another extra acceleration and incubation program. Not just the one from Bridge for Billions, but one specifically built for Africa Basque Challenge. And we are trying to structure an investment fund that will be able to fund for each team at least the selected teams, with about 40,000 euros. Okay? As you know, the prizes that we give will only be unlocked with actual budgets of how is it going to be spent and with the approval of the organization, because the money is to create, as some people from ABC of past years have seen, and what is happening already. So, without further ado, are you ready? I think we need a bit more energy. Are we ready? Let's go, let's go. Okay, 3 prizes. The third of all, much feedback, and I will encourage you to all of you to pass through the judging panel after, because there is a lot of interest and great difficulty. That's why we are so late to suggest. But we're going to take it step by step. So come forward. Pausu! Where's the red? Coach, please, coach. Well done, Pausu! Now, one of the problems of the judging criteria was how do we value? Specifically, we want impact. How can we create impact? Do we value innovation? Do they need to be creative projects? Is it more important to be innovative or to have impact? And there, under that question, the next team came signing through. A team that is not proposing something new. A team that is proposing to scale impact, to take something that already works to a lot of places. A team that has decided that that is an excellent solution that is actually being developed in a low-income settlement, and it could be a solution for the whole world. A team that wants that technology to come out of Kibera, please give a warm welcome to Ure! Well done, team! Now, for the final prize, be aware that after this, each and every member is going to receive the title. You have gone through this. You have gone through this. You traveled through this map that we had. You've done the journey, and now you're part of a community. And because of that, we're going to give you a title. Those of you who want to leave, of course, we won't take any more time of you, but participants, stay here because each and every one of you deserves a recognition, okay? Now, the next team is one that it was not really up to the jury to decide that deserved the prize. It was actually the amount of people that were ready to pay for their solution that was decisive on realizing that this is a team that can turn in a short time their project into a reality. Please remind me, was it 80 people wanting to buy? 100? 100? Okay, so the winner, sorry, let me take that away. The prize to turn the project into a reality as soon as possible is Well done, everybody! So thank you all for being here. Eskerrik asko. In a minute, you can. Those who need to go, you can go now. But all participants, please stay because each of you deserve a title, a title of being member of this community. So I'm going to be calling each of you, but please, those who need to go, please stand up and go. Okay. Venga, va, torre. Now, before we start giving the prizes to each person, please fill it. Come here to collect your memory prize. Zeintzuk diren besteak? Come on, fill it, quick. The rest of the team. It's okay, it's okay. Give it a clap. Next one, stay here. Next one. Gender equality, please come up. Gender equality. Hey, nice chapela. Gender equality. Setu, please come up. Setu, stay. Setu, please come up. Setu. Big clap to Setu. Now Danok, not all of us, but just Danok. Danok bakarrik. Venga va. Stay there. Children first. Let's go. Let's go. This is something done at the workshop from Este and as a present for all of the teams. Diatecnia, please come up. Ure, get ready to come up. Pierre is missing. Okay, Ure. Give a big clap to Ure. Yeah. Pausu, please take a step forward. Farm Link, please come up. Okay, Farm Link. Yes. And Farm Link, and that's it. Okay, now we're gonna give the titles to each of you. So as you receive it, I'd like you to clap as you clap for Diatecnia. Okay, to each of you, and stay here because this is yours. You are the protagonist. You are the ones who need to be at the stage. So I'm going to come down and I'm going to ask Paula Ansa García. Give it a big clap. Mirari Balensetegui Barrenechea. You are the protagonist. Pierre Cansabiel. Iraiz Gerriko Mújica. Cecilia González Danza. Víctor Baranza Wandera. Mohamed Atieno Aniwaño. David Kennedy Okello. Ekinye Isaguirre Santoyo. She's in Berlin, isn't she? But let's give her a big clap anyway. Yon Yayo Guirao. Kefa Mokaya Yuangan. Oyer Larandagoitia Echevarría. Muleni Sanses Monueniza. Caroline Moller. Yusuf Abdawali Mohammed. Anne Ortega Obrerón. Emma Muihaki Macharia. Yone Otazua Calzala. Benwende Mise Owendrao. Fabrice Nasonhiwa Lokenga. Irene Persona Miembro. Edwin Obsuhuru Kutai. Alain Rodríguez Martija. Jean Kasudi. Laura Sánchez Vindel. Aminata Niadille. Ousmane Mboye. He's not here, okay. Papa Jibril Sako. Valérie Diole Sambo. Ready to clap for this one? You still have the strength, stretch? Yeah? Yeah? Okay, Abdul Kadresek! Papa Diallo Sila! León Aviero! Hezram Melchizedek Anuja! Kuresha Nurhadam Ali! Fernández y Mori Aluda. Merci Yevkenmoy Barmasai. And John Lambert Bunwasi. This is from us to you, who are the real protagonists. Well done. Okay, photo everyone together. Let's go, photo, photo, photo. One photo everyone. Venga, va, torri. Harry, Argaskian, come to the photo. Come. Argaskina. John, Mercedes. Please. Team coaches. Come. Muriel, come. Okay, so we're going to try something that we do in the Basque Country and in Kenya. In the Basque Country, we call it irinchi. In Kenya, I don't know how you call it. Ready? We all scream. 1, 2, 3.